Hey everyone, this is our educational video for today. What I wanted to talk about was something that is vastly misunderstood and very common to people is actually what's called back spasms.
Doctor said I need a backiotomy.
If you're one of the unfortunate people who have had back spasms in the past, you know what it's like. It comes out of nowhere and it can really cripple you and leave you incapacitated for a long time. What I wanted to talk about today was why this back spasm happens. So we got a fancy diagram in here. So basically what I wanted to draw first was a segment of your vertebrae or your spine. Up here are what's called the vertebrae, and in between is called the disc. The disc is a really good shock absorber. It's designed to handle force like this all day long, and that's what it's really good at. What I drew over here was some muscles. Muscles in your back, their job is to support and cushion your spine and allow it to have stability. Over time, with sitting, bad postures, overwork, just everything, these muscles get overworked and they develop this stuff that's called adhesion. It's like glue that gets inside the muscle, and when you have adhesion, it makes the muscles weaker and less flexible. It's also the most common cause for those problems, which is bad enough, but what happens is the muscles are actually supposed to support your disc and your bones, and they can't. Now what happens is your disc starts to slide and grind on itself. When that happens and we cut this open, the inside of your disc looks like the inside of a tree. In the middle is what's called the nucleus. It's a toothpaste-like substance, and around here are these rings or ligaments, and it wants to stay nice and compacted and compressed. It doesn't want to slide and grind on itself, but when you have all this soft tissue dysfunction, it puts more pressure in here. So what happens over time is you start to get some tearing in through here. That's when your back feels tight or feels uncomfortable, but over time, this toothpaste or this nucleus starts to come out. When that happens, your body goes on lockdown. Everything tightens up, it seizes up. That spasm is actually happening for a reason, because it's trying to protect your low back and protect your disc from getting any worse. So if you've ever had a spasm and you feel like you're crooked, it's because your body is trying to take pressure off of that and keeping that from getting worse. So what happens is when people get back spasms, they panic. They freak out. They go to the emergency room. They go and see the chiropractor right away. They try to stretch it. They try to roll it out. The problem is that spasm is happening for a reason. It's almost like when you sprain your ankle, you start to limp to take the pressure off of there. So when you have a spasm, the best thing to do is to get in a relaxed position, lay down, and let it chill out. If you get in there and try to stretch it, roll it, adjust it, you're actually going to make it feel a lot worse. It might make you temporarily feel better, but that spasm is happening for a reason, because it's trying to protect that disc from getting any worse. So if you've suffered from back spasms and you continue to get them, it might be time to figure out what's fully going on. Or if you know anyone else that's had problems with back spasms, share this video, tag them in it, or send us a message. We'll be free to talk about anything you want to regarding back spasms. So thanks for watching our video, and please share with anyone that you think this will help. Have a great day.